Welcome to Community in Humanitarian Settings, COVID-19 Microtraining. I'm Donatella Massai, Senior Technical Lead of the READY Initiative from the Center for Humanitarian Health at Johns Hopkins University. It is my pleasure to address this module. This presentation will focus on the promotion of cross-cutting and intersectoral approaches in community health programming in the context of COVID-19. In this presentation, we shall provide a brief overview of how COVID mitigation measures should include and take into consideration a broad range of action with a view to integrating different sector and cross-cutting themes in the response. We shall talk about the centrality of the community and the linkages between community health programming, risk communication, and community engagement, and infection prevention, control, and WASH. We shall use gender, mental health, and psychosocial support, ethics, protection, social welfare, and One Health to explore cross-cutting issues. Direct and indirect impact of COVID-19. COVID-19 impacts all aspects of the individual, the family, and the community life. At the macro level, global economy, trade and commerce, and international relationships are equally impacted. COVID is a public health emergency with broader implications for people's lives and livelihood. The COVID pandemic can impact people and societies directly and indirectly. Responses call for a whole of societies approach. Direct impact includes effects on health and the health systems, while indirect impact is related to a mitigation measure and their intended and unintended consequences. For instance, measures such as lockdown and closure of schools have the potential for a dramatic influence on learning and development, on food stock and market capacities, and the availability of labor. An effective response must therefore keep people and community at the center, consider far-reaching economical, social, and political impacts of COVID-19, be adapted to context, availability of resources, and community needs, and in the respect of holistic approach. This implies a comprehensive understanding not only of the medical impact of the pandemic, but of the broader interrelation of the individual with the community and the society at large. We know now that cross-cutting intervention, bringing together a whole of society approach, result in a better outcomes, including mortality reduction, and preserving human dignity. Different services targeting jointly identified beneficiaries and providing a standard and agreed minimum package of services for the most vulnerable should be the common aim. Unintended consequences and the mitigation measures. While each of these measures that you see are appropriate to mitigate the impact of COVID-19 and to flatten the curve, each one carries a heavy load of social, cultural, and economical consequences. The list of unintended consequences, as we know, is very extensive, and it is not the objective of this module to provide an exhaustive compilation. We can, however, identify issues with broad and nearly universal impact, with consequences extending to the humanitarian field. For instance, we can mention the dramatic impact of lockdown on daily wages, access to essential common goods, and food basket. Isolation and quarantine adopted to slow transmission of the virus, restrict freedom of movement, and In the process, may reduce access to key services. Limiting on people gathering may impact religious practices and can have profound psychosocial implications at individual and community level. As we can see, for each of those mitigation measures, we can engage in an exercise, identify the negative aspect associated with them. Border closure, for instance, prevent the supply of seasonal agricultural labor, which in turn affect food supply and the price of agricultural products. Migrant families left behind may lose access to remittances. Measures need to be taken to mitigate any such unintended consequences. What is integration and cross-cutting approach? The concept of sectoral integration and cross-cutting approach challenges the traditional sectoral division of responsibility and expertise and often generate some form of resistance. While we are all used to work in silos, an effort to overcome artificial division is more than ever necessary in this context. This definition helps understand the complexity of this effort, which aim at bringing under one common framework multiple perspectives. We define integration as an integrated programming that holistically addresses the multiple and interrelated rights, needs, risk, and vulnerability of individuals and communities. An integrated approach therefore ensures that interventions from different sectors and themes do not take place in isolation, but instead reinforce one another to achieve the best possible outcome with the existing resources. Similarly, cross-cutting means that sectors work together in all project life cycle from inception to closure, each one with its own agenda and tasks. This means working across disease silos and disciplines to effectively address public health issues to enhance global health equity. Why is integrated and cross-cutting programming so important? COVID is a public health emergency with broader impact on people's lives and livelihood. Responses call for a whole of society approach. COVID is creating a vicious circle whereby high level of inequities fuel its spread, which in turn deepens inequalities. Only an inclusive public health integrated response will enable us to defeat the virus. This requires dedicated effort to ensure equitable access to care and eventually to a COVID-19 vaccine once it becomes available. Only inclusive social economic recovery package that include vulnerable groups such as IDP, refugees, migrants, workers, will help our economies to restart and recover. Long-standing inequalities and unequal underlying determinants of health are leaving individuals and groups disproportionately impacted by the virus. No one will be safe until everyone is safe. The pandemic and its effects are hitting harder those who are already the most vulnerable, even before the crisis. These include people living in precarious circumstances, as well as those in fragile and conflict-affected countries, in particular women, children, and older persons. Whether there is a widespread community transmission, widespread community transmission and access and movement are restricted, we must continue to maximize our resources to ensure the bigger collective impact across sectors. Sectors such as wash, protection, education, health, nutrition, for example, should all share the expertise to collectively identify integrated solutions for positive health outcomes. Now, more than ever, it is vital to adopt a collaborative approach that will build on existing structure within countries, or in absence of multi-stakeholder platform, establish whole of society mechanisms to pursue a coordinated response with a clear flow of information to support the continuation of services, build trust, and meet community needs. Integration and cross-cutting consideration. There is a growing recognition that multi-sectoral integrated programming is essential for coherent and effective humanitarian response. The health status of the population is impacted by multiple factors far beyond the provision of preventive and curative health services. Additional factors directly impacting morbidity and mortality of the population in a humanitarian emergency include availability of water and sanitation, food security, preventive and curative health and nutrition services, and protection. Availability of adequate shelter and good camp management will also affect health status. Health intervention may be conducted in collaboration with schools and other existing services, while logistics and telecommunication support would also significantly influence the effectiveness of the health response. Integration as a concept has several different interpretations. It is therefore important to establish a shared understanding between clusters of what integration in reality means. Different processes may promote the integration of activities and contribute to their implementation. A range of integration modalities may be applied depending on the context they should be addressed and existing policies and approaches. Effective integrated programming. Effective integrated programming for better health outcomes require a number of sequential steps. Harmonize assessment and project analysis of the health status of and vulnerability of the affected population, joint prioritization of the most vulnerable among the target population for a multi-sectorial integrated response, definition of the specific responsibility of each cluster or sector, and the strategy and operational linkages to promote a collective action. Develop also and implement an integrated response plan, budget, and monitor and evaluation framework for increased efficiency. Special attention should be given to underrepresented or hidden vulnerable groups. These include minorities, stateless people, street children, undocumented migrants, and other people living below the visible line because of systemic discrimination. How do we increase effectiveness of integrated programming? In this section, we will emphasize how effective community engagement can make a difference in improving public health outcomes. We know after several responses to epidemic, including Ebola 2014 and the most recent in DRC, that community-driven response are key to ensuring effective and sustainable outcomes. We know that understanding the community context and ensuring awareness on community dynamics, social and power structure, attitude, perception, and practices are critical for community health programming. Risk communication and community engagement approaches need to go beyond information sharing. It should aim at motivating people to adopt safe health practices and complying with mitigation measures such as social distances and lockdowns. This means using two ways form of communication to engage community in discussion about COVID and how it can be prevented. It is important to build community ownership and active participation in COVID-19 response by identifying and supporting community-led solutions for bringing the outbreak under control. Asking people what they know and what they need and involving them in designing and developing COVID-related services and prevention approaches improves the effectiveness of our community intervention and sustain the changes we promote. Only with the level of community involvement just mentioned, community health programming can adapt and prioritize health services such as screening, vaccination, and treatment. On the other hand, improve communication between community members, community health workers, and health clinic increases health-seeking behaviors and improve linkages to additional services such as referral, nutrition, vaccination, and mental health. In IPC and WASH, improving water and sanitation condition is essential to protecting human health during all infectious disease outbreak, including COVID-19. Ensuring good, consistently applying wash and waste management practices in communities, homes, school, marketplace, prisons, and healthcare facility will further reduce human-to-human transmission of the disease. Improving access to personal hygiene, household disinfection material, and additional safe water to enable children, caregiver, and their community to practice good hand washing behavior is paramount. The COVID-19 hygiene promotion activities targeting household, collective vulnerable sites, and public spaces should be well aligned with risk communication and community engagement strategy, specific to the COVID known transmission route and aim to reducing the exposure to the disease and at home and in the communities. Mental health and psychosocial support. Understanding and addressing mental health and psychosocial consideration will be crucial to effectively stop transmission and preventing the risk of long-term repercussions on the population well-being and their resilience. These include the integration of mental health and psychosocial approaches and activities within community health programming. Mental health intervention should be carried out within general health services, including primary health care, and could be organized in other pre-existing structures in the community, such as youth and women and community center. Mental health and well-being of frontline workers need to be addressed and supported. The impact on mental health and psychosocial is much more pervasive of the picture we are presenting in this limited space, and WHO and the UN Interagency Standing Committee guidelines offer additional resources. In each context, it is necessary to understand the needs of specific groups within the population who might experience barrier to accessing information, care, and support. Mental health and psychosocial support should be accessible and adapted to the mental health and psychosocial well-being of children, their family, and the wider community, the elderly people, with disability, and other vulnerable groups. Special attention must also be given to specific needs of women, men, girls, and boys. Mental health and psychosocial approaches need to evolve and adapt to the needs of each population affected by COVID and provide basic emotional support to persons experiencing distress and at different time of the outbreak. Protection and social welfare. As mentioned, the health status of the population is impacted by multiple factors far beyond the provision of preventive and curative health services. Provision of protection impacts directly the provision of other services and positive health outcomes. Protection ensures linkages between the psychosocial services provided through the protection partners and the mental health services. We know that protection intervention promoting safety reduce the incidence of violence. Increasing access to health services for survivors of gender-based violence and relevant referral between the protection and the health clusters will ensure that the health consequences, both mental and physical, of gender-based violence are addressed. Ensuring protection services when households are placed under strain and intimate partner violence and other forms of domestic violence become more frequent is of particular importance during COVID. Gender. In the response to disease outbreaks such as COVID-19, it is to be effective and not reproduce and perpetuate gender and health inequities. It is important that gender's norms, rules, and relations that influence women and men, differential vulnerability to infection, exposure to pathogens, and treatment received are considered and addressed. The response needs to consider multiple and intersecting forms of discrimination and inequalities, including pervasive gender inequality. It is known that the impact and implication of COVID are different for men and women. Women healthcare workers are, for example, playing a disproportionate role in responding to COVID-19. Women are hit harder by economic impact caused by COVID. Overstretched health services often divert resources away from services women need, including pre- and postnatal care, and exacerbate a lack of access to sexual and reproductive health services. On One Health. The One Health concept recognizes the connection between the health of women, animals, and our shared environment. Many countries are establishing national One Health coordination mechanisms to help prevent, detect, and respond to disease risk across different sectors. However, One Health thinking can also be helpful at community level to identify possible household risk, vulnerability, and impact, and target supportive services to safeguard populations. The following One Health approach should be considered to help assess and mitigate risk and impact and promote coordinated understanding, messaging, and action to provide clear messaging on disease risk in humans related to animal population. Persons sick with COVID should avoid contact with animals to prevent transmission to other species and possible disease impacts on animal population. Other zoonotic and vector-borne disease risk should be considered by community on a continual basis and assess vulnerability to animal and environment exposure that may present disease risk. Concern over food insecurity should be given special attention. Increased resilience and on wild meat source for protein could potentially result in new or increased exposures. Some responses to disease concern can end up exacerbating the problem and could potentially have a long-term effect on ecosystem integrity and wider ecosystem services. We need to consider that bats and other wild animals provide important ecosystem services such as pollination and pest control, which in turn support food provision and contribute to the healthy forests that mitigate soil erosion and natural disaster. It is therefore important to advocate for zoonotic disease risk reduction at national, subnational, and community level. Now some ethical consideration. COVID has put a burden on availability of resources, both in low, middle, and high income countries. Setting up decision-making systems and procedures in advance is the best way to ensure that ethically appropriate decision will be made when an outbreak occurs. For both pragmatic and ethical reasons, maintaining the population trust in epidemic response effort is of fundamental importance. This is possible only if policymakers and response workers act in a trustworthy manner by applying procedural principles fairly and consistently, being open to review based on new relevant information and acting ethically with the affected communities. The dilemmas we often face are related to the scarcity of the resources. Availability of ventilators and other medical and non-medical supply is limited, and needs are far greater. Humanitarian workers and health professionals may have to decide to withhold ventilators from people who have limited chance of surviving, saving them for those with higher survival rates. We may have to act without laboratory confirmation or performing reanimation where sterility cannot be guaranteed, thus posing major risk of infection. In the COVID-19 response, medical and non-medical staff may be requested to act beyond their competencies, and in some cases, we may be requested to perform like when a cardiologist is asked to deliver a baby on an airplane. Normally, acting beyond competencies is unethical. You may be feeling conflict when the public health authorities give no choice for sending people to a quarantine facility when we know that standards are not met. Setting up decision-making systems and procedures in advance is the best way to ensure ethically appropriate decision will be made when an outbreak occurs. Countries, healthcare institutions, international organizations, and others involved in the COVID response efforts should develop practical strategies and tools to ensure accountability, transparency, and inclusiveness, taking into account local, social, cultural, and political context. We are now at the end of our presentation. I trust we have been able to identify how to include and take into consideration a broad range of measures with a view to integrate various sector and cross-cutting consideration in the response. I hope that you feel more familiar with the critical integration and cross-cutting issues informing the COVID-19 humanitarian response. Finally, remember that COVID-19 adaptation to programming and community-based health services and services provided by either actor are mutually reinforcing. The overall success of the response depends on the synergy between all those sectors. Thank you for your attention, and please stay safe.